This video is going to talk about ectopic pregnancy. Ectopic pregnancy is the implantation of a conceptus outside of the normal uterine cavity, and in UK, it happens in 11 out of around 1,000 cases of pregnancy. The common sites for ectopic pregnancy are the fallopian tube, which is the most common, 95%, and also it can also happen in the ovaries and cervical ectopic pregnancy. For fallopian tube, the commonest area is the ampulla, but it is also the least dangerous because it is the widest part. And ectopic pregnancy can also occur in the isthmus, fimbral end, and interstitium of the fallopian tube. The risk factors of ectopic pregnancy are pelvic inflammatory disease, previous ectopic pregnancy, previous tubal surgery, subfertility, use of intrauterine contraceptive device, endometriosis, and also assisted reproductive technique. The clinical features of ectopic pregnancy include the classical triad, which are amenorrhea, lower abdominal pain, and vaginal bleeding, which normally is dark red in color, and also symptoms of anemia and shoulder tip pain, especially in ruptured ectopic pregnancy cases. So why is there shoulder tip pain? It is actually a referred pain when there is accumulation of free blood in the abdominal cavity. So the accumulation of blood will irritate the diaphragm and then stimulate the phrenic nerve, thus causing shoulder tip pain. For physical examination, on general exam, the patient will appear pale and we might see some signs of hypovolemic shock. For abdominal exam, there will be distended abdomen, abdominal tenderness, rebound tenderness, fluid thrills, and also positive shifting downwards. For bimanual exam, we might feel some tenderness in the fornix, presence of cervical excitation pain, fullness in the pouch of Douglas, and also feel some adnexal mass. For investigation of ectopic pregnancy, first we do full blood count to look at the hemoglobin level to see if there is any anemia. And then to confirm the pregnancy, we can do urine pregnancy tests. So for ectopic pregnancy, this usually shows positive results because there is pregnancy. And then when pregnancy is confirmed, we do serial beta HCG level. This is to differentiate whether the pregnancy is in the normal uterine cavity or ectopic pregnancy. So in normal pregnancy, the serial beta HCG level is supposed to rise very high, more than 66% of the normal level. But if it only rises a little bit, then we should be suspicious of ectopic pregnancy. And next, to confirm the ectopic pregnancy, we can do transvaginal ultrasound to look at the location of the pregnancy and see if there is any presence of adnexal mass or free fluid. So in ectopic pregnancy, when we do the transvaginal ultrasound, we will not see any gestational sac within the uterine cavity. And we can also do laparoscopy. Okay, next, for management of ectopic pregnancy, I divided the management into 3 groups here. First group is expectant management. So in expectant management, we allow tubal abortion without any treatment. But we do regular monitoring of the HCG levels and also ultrasound. Next, the other choice is to do medical management, which is intramuscular injection of the methotrexate, which is a folic acid antagonist. And the third group is surgical management, which can be done through 2 approaches, either laparoscopic or laparotomy. So there are 3 types of surgical management. Salpingectomy, the first one, is the removal of fallopian tube. The second one is salpingotomy, where we create an opening into the fallopian tube and take out the abnormal tissues and take out the ectopic pregnancy. And the third type is the salpingo-oophorectomy. So that's all for this video. If you like this video, do hit the like button and subscribe my channel for further updates. So that's all for this video. See you in the next one.